Well, fortunately, flu season is on the downswing, but it's still nothing to take lightly. In fact, here on Delmarva, we've seen almost a dozen deaths from this flu season alone, 4 of them children.
Now, you probably recall Lisa and I got our flu shots back in September. Now, we've been protected so far, but the flu season is not quite over.
Unfortunately, Jimmy, even those who've gotten the flu shot or missed are getting the flu. And here to tell us why and what else we can do to protect ourselves is Dr. James Cockroft from the Wicomico County Health Department. Thanks for joining us this afternoon.
My pleasure.
Now, people who got the shot this season, like we said, are still getting the flu. Why is that?
All vaccines are imperfect. There's no vaccine that is 100% effective against anything, and that's also true for the influenza vaccine. The CDC, the Centers for Disease Control, publishes information on their studies about the efficacy of influenza vaccine and other vaccines. And it usually is some 60 to 65% reduction in influenza illness for people who've had the vaccine versus people who haven't. And the current figures for the 2013-14 season show a 61% reduction. And that is the case even though the dominant strain, and there's different strains of influenza, the dominant strain this flu season is the H1N1 strain that's been around since 2009, and it has been included in the vaccine since 2009. So some years the strains that are used to make the vaccine, which has either 3 or 4 strains of influenza virus in it, don't match with what comes around, because you have to make that judgment 6 months ahead of time. This year there's a good match, but despite that, it's not 100% effective. And some people do not respond as well to a vaccine. They don't get as strong an immune response as other people.
Well, I was going to ask you, well, then why take the flu vaccine?
Because it does reduce the probability of getting influenza. So so it's less likely for an individual to get sick with influenza. And there's very strong data that every year we have a marked reduction in the deaths from influenza among the population who's had the flu shot. We have a reduction in the cases of influenza, and we have a reduction in hospitalizations.
But kids, I guess people with low immune systems or compromised immune system, and very young children. And very
the influenza vaccine isn't given to at least 6 months of age. It doesn't seem to work well on very small children, but it is given 6 months and above. The older people tend to have less of an immune response, and the effectiveness in getting protected against influenza from the vaccine is diminished in older people. For the last couple of years, there's been there are many different influenza vaccine products available now, and there's been one that has a higher concentration of the antigens from the viral strains involved that's indicated for older people, and there's some evidence that that gives a little bit more protection for older people.
So a lot of times people are saying, you know, I don't know if I got the cold, I don't know if I got the flu. How can we tell if it's the cold or if it's the flu?
Early on, they're very similar. People feel kind of crummy and cough and runny nose and such. The influenza tends to be worse. People with a cold can often, even though they don't feel at their best, they can function and go to work, and which isn't necessarily a good idea because you spread it to other people. But with influenza, people feel so rotten with the body aches, the headaches, the fatigue, that they tend to not be able to get up and go about their normal activities. And the cold will typically last just a couple of days. Influenza will last longer, 5, 6, 7 days.
Oh, okay. So what can we do to further protect ourselves?
The absolute best protection against getting the influenza is the influenza vaccine. There's nothing else that's even close. Beyond that, the things that are done to help to prevent influenza are personal hygiene of washing hands frequently, using Purell, washing off doorknobs and telephones and such, and being careful to not sneeze and cough on people.
Is it too late to get a shot?
You can get the flu shot. You can still get it. They're not as available as they were back in the fall. The influenza has reached its peak. It's on its downward course, as happens pretty much every year. So it's a perfectly reasonable thing to get. It would be better to get it back in September,
right,
and have the protection throughout the season. There is still influenza around, and a person who hasn't had the shot would have some degree of protection against getting sick with the flu.
So let's say, and I'm telling you now, I don't have the flu, but let's say I didn't get my shot, I did get the flu. How long am I contagious?
The best data is that the period of contagion begins even before you're sick, about a day before the onset of symptoms, and an infection just goes on for 5 to 7 days following the onset of symptoms.
So stay away from everybody else. Dr. Cockey, thank you so much. Wonderful information this afternoon.
And if you missed any of this information, if you'd like to learn more on how to protect yourself from the flu this season, visit our website, delmarvalife.com. So now that you know how to better protect yourself from the flu, how about treating it? Coming up next, we'll learn how one of the oldest treatments in the world is now being used on the littlest patients.
And a little later on, from rapper to preacher to reality star, now Run DMC's Rev Run is taking on another role. Health advocate, the personal connection that has him urging others to know their risk for diabetes. While we're talking about your health, Dr. Oz tells us how we should be preparing before our next checkup.
Hi, I'm Dr. Oz. Make the most out of your next doctor's appointment. Before you go, write out your medical history and your symptoms. Bring a list of your medicines and allergies. It's okay to bring a friend or family member. They can help you remember what was said. And before you leave, ask about how to follow up with questions and test results.